A child born in a hospital in the United States today, within hours of coming from source into this, into this body, the first thing that happens to them is pharmaceutical intervention without really asking, there's barely informed consent about this. That child's eyes are smeared with erythromycin ointment and they're given a hepatitis B vaccine in their first day of life.
Hi, my name is Dr. Rubin, and it really saddens and frustrates me that she's going to be the next Surgeon General of the United States who goes on podcasts demonizing medical interventions that are meant to prevent severe complications to babies, that I highly doubt she's ever even seen them during her medical training, because she trained as a surgeon and didn't even finish her medical residency. And I hope she never has to see those complications, but by scaring people like this, there are going to be people who will listen and start to refuse some routine medical interventions that are potentially life-saving. And even if these complications are rare, no parent would ever want to see these things happening. As an example, the erythromycin ointment given to a baby after birth is meant to prevent ophthalmia neonatorum, which is usually caused by gonorrhea, which can cause permanent vision loss. A vitamin K injection is given at birth because that prevents vitamin K deficiency bleeding, which I've seen one case of that during my training, and that baby had a stroke. That can actually happen. It's about a 1 in 60 to 1 in 250 chance. If you refuse that injection, that type of bleeding could happen and it could be life-threatening. The third is the hepatitis B vaccine at 24 hours of life. Not at birth, but it's given at 24 hours of life to effectively eliminate the risk of hepatitis B transmission from happening, not just from mom to baby, or they like to talk about a sexually transmitted disease, or from needles. It can come from open cuts or sores that could be transmitted during the hospital stay, or theoretically at home from other household members who may not even realize that they carry hepatitis B. But about 90% of infants infected with hepatitis B go on to have chronic liver disease, liver failure, liver cancer, and premature death, which no parent would want. It's the same reason why you buckle up your kids before you start moving your car out of the driveway. It's highly unlikely that someone's going to hit your car while you're rolling out of the driveway, but it can theoretically happen. So why are you taking that risk?